Hello everyone, this is Chadi Alraies from Heart Trending. Today I would like to talk to you about a topic that I have been asked to talk about before, which is the syncope or passing out. So what is syncope or passing out? This is a very important topic and has a very broad causes as well. So syncope meaning patient or person is passing out for a certain amount of time, sometimes seconds, sometimes goes up to hours, and the causes are very variable. Can be something because of the brain, or because of the dehydration, or because of the heart causes. I'm going to summarize it in three categories as I mentioned earlier. Number one, if there's a brain cause or if there's neurological cause, can be because of seizure. Usually the patient have a jerking movements and witness kind of falling on the floor, is unresponsive, and have sometimes very brisk jerks and sometimes very fine jerks. So this is happen in younger population, especially people who have history of seizures or family history of seizure. Now, second causes for neurology as well is if there is somebody have risk factor for a blockage in the arteries, like a stroke, for example, diabetes, hypertension, smoking. So it might be a stroke, can be a manifestation with a passing out as an initial presentation of a stroke. So this is again require immediate attention and calling 911. The third cause is, from neurology standpoint, is what's called vasovagal. So what is vasovagal? I think you hear it all the time, and I think it become the public more familiar with this term right now. Vasovagal means the vessels that bring blood to the heart, which is the veins, lose the tone or the nerve to squeeze these veins to bring blood back to the heart. So when patient changing position from laying down to standing, or from standing, or even sometimes if they have an emotional stress, like a good news or bad news, this tone that or nerves that supply nerve tone to the veins kind of completely collapse, and then the blood pool in the legs, and patient lose perfusion to the brain, and eventually they pass out as a normal reaction. But as soon as the person collapses on the floor, a few seconds later she or he comes back because the blood kind of the G-force or the gravity bring blood back to the brain, and brain restart. The other causes is, which is sometimes very common, we see it a lot in younger kids as well as in young adult, and also some elderly, is dehydration. Dehydration is very important, especially if the person is not keeping up with their fluid intake, if they are on a high dose of diuretics and they are using the bathroom a lot, and because the doses of diuretic is high, and also if in hot weather or hot states and you are working outside all the time. So you have to keep up on that. Obviously, if your volume in the system is down, your blood volume will be down as well, and the brain not get enough blood supply, and as a result of that, everything will collapse, causing syncope. The third cause, or the third category of causes for syncope or passing out, is heart disease. Heart disease is one of them, almost more than 40% of the causing for passing out, but it's we get consulted a lot, even coming to clinic or in the hospital. And what are the causes? And it can be summarized in two things as well. Either there is an electrical problem in the heart, or there is a blood perfusion to the heart. The electrical problem, it can be, it's a big, people write chapters about this, for example, or textbooks about this topic. But again, to summarize it, either there is electricity that because heart go out of rhythm, as I spoke to you before about the palpitation episode on the previous episode. I will put a link at the bottom of the prescription. But again, if this is something, if there's electrical issue like AFib, A-flutter, or the heart goes into what's called ventricular tachycardia or a ventricular fibrillation, which is a very bad rhythm, people will pass out from this, and sometimes they have to be shocked with a defibrillator to come back. So this is kind of one of the most advanced, and the causes for this is also variable. We'll talk about it in a previous episode about cardiac arrest or heart arrest in the future episodes. More kind of benign version is if there's somebody has a blockage in the heart and or heart attack, can cause this also to patient to pass out. Although very rare percentage of people pass out, usually have the chest pain, the shortness of breath, and usually they have a cardiac collapse or completely collapse requiring CPR or chest compression to revive that person. So again, I hope this episode for syncope or passing out was helpful. Again, there is a lot of reason about syncope. We can cover them in a different episode, but I just wanted to highlight the three main reasons and what we can do to help you identify these symptoms, and so you can seek the appropriate therapy and seek the specialist that can provide you the best care. I hope you enjoyed the episode. Thank you for watching. This is Chadi Alraies from Heart Trending.